For many parents, keeping your child protected from COVID-19 and this highly contagious variant is a top priority. Whether your child is an infant, toddler, or is back at school, you want to keep them safe and healthy. Joining me on the shortcut with an important message to parents is Dr. Sandra Arnold from the Bonheur Children's Hospital. Hi, Dr. Arnold.
Good morning.
Good morning. So being a parent to an infant or toddler right now with the Delta variant surging leaves a lot of questions. What steps can parents take to best protect their child?
The most important thing is that everybody around an unvaccinated child should be vaccinated. We do this already with other vaccines. We give pregnant women pertussis vaccine every time they're pregnant and recommend that everybody who's going to be around that baby get pertussis vaccine. That's whooping cough, because we know that's a particularly dangerous disease in young babies. And we should be doing exactly the same thing with COVID-19. All the people who encounter that baby should be vaccinated, and they should be avoiding people from whom they might acquire COVID-19 by wearing masks when they're in public places and trying to avoid large gatherings as well.
And if someone thinks their child might have COVID, what should they immediately do?
If you think your child has COVID, you need to call your pediatrician. The best thing to do is just to have them evaluated. Most babies are not going to get very ill from COVID, but they often get fevers, and very young babies with fever will need to be evaluated by a physician. Speak with your office's nurse or take them in to see the doctor, and some doctors' offices can test the baby for COVID, or they'll direct you to a place that will do testing on a baby.
And what would you say to someone who has pre-existing conditions and is fearful about the side effects from the vaccine?
I would let them know that they need to be, unfortunately, much more fearful of the disease than they need to be of the vaccine. We have not seen very many side effects from this vaccine. We know they do exist, that things can happen to people. We've seen people get inflammation in their heart after vaccine, although that's most common among teenage boys and not among adults. And what I would say is that the risks of the vaccine are far, far, far outweighed by the benefits, and the risk of disease is far greater. And we really, really need everybody to get vaccinated.
And is there anything else that you think is important for parents out there to know on better ways to protect their child from COVID?
I would just say that remember that vaccination is the most important, but of course we know that there can be breakthrough infection even with vaccine. And so you just need to be very careful about what you're doing. You need to make sure that you wear a mask whenever you are out, and you need to insist that if anybody wants to see your child, that they need to be fully vaccinated, and they need to be very careful when they're out in public.
Great information for parents and really everyone out there. Thank you so much, Dr. Arnold, for joining us on The Shortcut.